Coffee Talk. It is episode 14, and today we're going to discuss the comorbidity of depression and autism. And I know we've touched a little bit on this in previous episodes, particularly the last one, and anxiety is very prevalent in autism as well, with the rigidity and the perseveration that you see oftentimes. Um, but I guess I didn't realize how often people with autism actually suffer from depression. And it's 3 to 4 times more likely.
Yep.
So it's very difficult to ascertain because there's such a major overlay. I just want to kind of chat a little bit about why it's more common with folks with autism and treatments and all of these things. So we can kind of start a discussion here, Dr. C.
Yeah, I mean, just as you said, we discussed, in the last episode, really trying to highlight the concerns about suicidal behaviors in individuals with autism, particularly, and the numbers are striking for, for people that watch the episode. I think it bears repeating that individuals with autism have a 9 times higher likelihood than their non-autistic peers to contemplate and attempt and complete suicide. Relatively recent study, parents of children with autism are 28 times more likely to identify their child as feeling suicidal than parents of non-autistic children. So it's a big deal. And the single highest risk factor for suicide in someone with autism is depression. So that's why it's so important.
Yes. I am astounded and grateful to hear you say that parents are identifying these things in their child, because oftentimes it's difficult to diagnose anything with someone who's not necessarily verbal or able to express themselves or articulate their feelings and whatnot. So I mean, obviously we say this all the time, parents are the experts on their kids. So I'm glad to hear that they are being mindful and aware of these warning signs, and we'll talk about that in a little bit.
But it was a surprising fact to me because just to your point, I feel like we're doing very often during our consults and our clinical work, like almost public service announcements of, by the way, people don't realize how often individuals with autism are suicidal. So to see a study that actually validated that parents are actually identifying this at a much higher rate in their kids, that's it was interesting to see.
So let's highlight just real quick what depression looks like, and we can talk about treatments and how that differentiates with autistic folks and their non-autistic peers.
Certainly. So we talked about this a little bit back when we were talking about diagnoses and bipolar disorder and things like that. But it's really important in behavioral health and psychiatry, in particularly. Making sure we're all talking about the same thing. So people use the word depression all the time. I feel depressed, he's depressed, she's depressed, and those are valid uses of the word. But when we're talking about depression, we're really talking about major depression, and that has very strict criteria. So going over just in general, you have thoughts of feeling depressed, maybe changes in your sleep, lack of initiative or motivation, feelings of guilt, hopelessness, helplessness, something we call anhedonia, which is loss of interest in things that you typically find pleasurable and enjoyable, suicidal ideation, changes in energy, etc., etc. And traditionally, you need to have 5 of those symptoms for 2 weeks, with a reduction of functioning in social relationships or work or school. And that is the definition of major depressive disorder, which happens in about 7% of adults in a given year. And as you've already noted, it's more like 26% of people on the spectrum, so 3 to 4 times more likely.
Yes.
That becomes a little bit more difficult in individuals who have autism, because the core symptoms of autism, perhaps a flat affect, so you're not showing emotionality, perhaps a social isolation or lack of social connections. A lot of the things that are core symptoms of autism overlap with the core symptoms of depression, which is why I think it gets missed so frequently.
Absolutely. And I just think it's important to note, folks with autism don't always have the ability to express how they're feeling and what they're experiencing at the time. And parents may be able to be keen to this and identify this, but it's hard because there could have been things that have happened, you know, on the bus on the way home from school, or maybe an incident. Maybe you had the wrong cereal this morning, and that kid is harboring that emotion, and it's coming out later. So it's important to really distinguish, was there an event that's causing my child to act a little bit more, you know, different? So one thing that I know we've utilized is really tracking these behaviors, such as appetite. Okay, well, you know, I'm not feeling good today. My sinuses are draining. I'm not eating much. I just want some saltines, whatever. Track these appetite changes. Note if there's other conditions kind of interfering or whatnot. Are there other suggestions that you would have to kind of help temper?
Yeah, some of the core symptoms of autism, and you're right. I mean, it's really difficult because it's not just that people on the spectrum who may not use many words, but actually even individuals whose language is fully intact. And by the way, the risk of suicidal behaviors can be much higher in kids with autism who are intellectually average or above average. So you know, important to note that. But it's not just maybe not having the words to say I'm feeling depressed, but actually the ability to identify emotional states just in general, not just convey them, can be lower. So that's where, you know, when we talk about diagnosis, what's the child's baseline? Now, granted, kids are developing and growing, and so their way of interacting, you know, find me a 14-year-old who isn't isolated in their room playing video games now. You know, I mean, that doesn't necessarily mean they're depressed. But you know, what's their baseline? What's the family history? Is there a higher risk for depression or anxiety disorders within this family? All those other things. You can't make a psychiatric diagnosis in one moment in time. You know, it's over a period of time. And if the individual can express to you what they have, then you have to utilize other sources.
Yes.
What are they like in school? Are they looking depressed and lower functioning education? Are there ADLs? You know, their hygiene, their other things. Have they gone in a negative direction? So you really have to look at these other pieces. But then going back to your point, parents really are the experts here. And so never underestimate a parent saying there's something different about my child. You know, they're acting differently, they're behaving differently. This is not him. Parents really are the experts. It's not psychiatrists, it's not nurse practitioners, it's not mental health counselors. It's parents know their kids the best.
And even if there's not sufficient evidence, just that gut instinct is enough to provoke that question and that mindfulness. So go with it.
Well, if you're considering suicide is 1, 2, or 3 the leading cause of death in individuals with autism, particularly kids, if you have a gut feeling that things don't feel right, to be perfectly honest, you know, that is as close to a psychiatric emergency as one gets, and that is definitely a reason to reach out for additional help and not just kind of sit on it and watch and wait.
So it might be more difficult to kind of identify, you know, that someone's depressed if they're on the spectrum. Might be in general population hard to identify, and there's a lot of treatment modalities available. I don't know that they differ so much between the two. So do you want to chat a little bit about that?
I think you cater the treatments for depression to individuals, and when we're talking about individuals on the spectrum, you know, you're catering to their ability to utilize language, whether it's written, whether it's through a device, or whether it's actual verbal exchange. Their ability to maintain concentration over an extended period of time, et cetera, et cetera. So, but you're right, the treatments, the categories of treatment are the same, right? I mean, there's, first of all, is structure, healthy lifestyle, right? What's the most important thing for any of us? Get enough sleep, have a reasonable diet, get exercise, get
Lots
exposed to sunlight, stay hydrated, things like that really do affect, right? So and people on the spectrum having structure to their life and predictability, particularly for those who struggle with transitions, is super important.
Yeah.
And then we're talking about therapies, right? Cognitive behavioral therapy, CBT, very helpful in depression and anxiety. Tends to be more approachable to people who have good verbal skills.
Yes.
There's ways to get around people who don't have good verbal skills, but you know, that can be helpful.
So particularly if they maybe are a little more receptive, they're able to understand the concepts,
Yes.
but maybe not recite things back. But there's other therapies, that could be useful, such as art therapy or
Music
music
therapy.
Yes.
Behavioral activation is an interesting, relatively new concept of trying to expose individuals to planned, scheduled, positive activities that they enjoy, so that there is a higher likelihood of having positive interactions with others, in the idea of reducing social
I like that.
isolation.
I like that.
I really like it for our population that is not going to be able to do talking therapies, because it's proactive. It's establishing perma in people's lives, positive interactions, positive experiences. We know series of negative experiences alone can cause depression, and so having these positive experiences, and plus they're beneficial to the family, to siblings, to other individuals who are part of the treatment team. So there's a lot of various talking therapies that can be done, and then we start talking about things like medications, right? And I don't think we're going to go into any extensive detail. We've talked about that in the past, but the primary medications that we use for individuals with major depression are the antidepressants.
Yeah.
Most notably the SSRIs, selective serotonin reuptake inhibitors, Paxil, Prozac, Zoloft, Luvox. There's others, obviously, and they have their place in this population. But given that their number 1, 2, and 3 side effects are irritability, headache, GI upset, and those things are already issues with people on the spectrum, and particularly people who can't express when they're not feeling well. They certainly have their place, but you have to really be careful about side effects
All of
and
these
monitoring for
things
side effects.
needs to be considered for sure. And there are certainly supplements and other alternative therapies that can be considered. But
we talk a lot about light therapy, and this is something, it's a mixed bag. A lot of kids with autism have sleep issues, and the bright lights that you can buy, they're typically 10,000 lumen lights. They used to be super expensive, but you can get them on Amazon for like $30-$40 now. The way they're traditionally given for seasonal affective disorder. So in the wintertime, people kind of get blues, and they're depressed, and it's dark out when you get up. It's dark when you get home from work or school. So,
especially in Buffalo.
In Buffalo, particularly, yeah. So the idea is you get up in the morning and you put this bright light on, and it's 16 inches away from your face, maybe when you're on the computer or reading a book, and do it for 20 or 30 minutes, and it can be very effective for treatment of depression. How much you can utilize that with maybe a nonverbal child or teen who has sensory issues.
But if they're already sitting on their tablet, it may be a viable
It really
option.
comes down to mixing and matching treatment modalities with things that individuals can tolerate, and that's true regardless of whether you have a developmental disability.
Yes.
The other treatment that we'd be remiss to not talk about is electroconvulsive therapy, or ECT. And a lot of people, it's got a lot of stigma associated with this, because this is quote unquote shock therapy, right? And One Flew Over the Cuckoo's Nest and other things like that, and people feel like, oh my God, it's such a extensive risk-laden treatment, intrusive treatment. And the reality of it is, electroconvulsive therapy treatment for people who qualify for it is the single best antidepressant we have. Antidepressants at their maximum benefit work about 60% of the time. ECT works like 95% of the time.
And isn't it the most safest intervention for depressed parents, mothers who are pregnant?
Absolutely. So, the primary risk of ECT is you're under general anesthesia for just a little bit.
Yep.
So it is literally the treatment of choice for a pregnant mother with severe depression, because it has far less side effects for the mother and the fetus than any medication. And I think, in subsequent episodes, probably next episode when we talk about catatonia during autism and major depression, we'll talk more about the utilization of ECT for that, because that is one of the primary treatments for that.
Awesome. So clearly there's lots of treatments available, but the key here is to be mindful of the warning signs, changes in these behaviors, appetite, interests, energy levels, mood, these sort of things.
Yeah.
So, please use your gut. Please be mindful. Please reach out. If you need help, let somebody know. Let your PCP know. let your psychiatrist know, let your treatment team know, let us know. We'd be glad to help. Um,
Yeah, I think this is one of those situations. We talk about this a lot with developmental disabilities, but particularly autism. These situations are not a situation where you're talking about early diagnosis when you have a 2-year-old and you think something is just not right.
something
But
amiss.
when you feel there's something on these, you're not being a nervous parent reaching out and looking for more help. These are the times that you reach out to your health professionals, your schools, etc.,
Absolutely.
and look for further guidance, because they're very serious conditions with a lot of mortality, a lot of morbidity associated with them, but they're also very treatable conditions.
Absolutely.
So, and I think that's really the take home message.
Yes. So trust your gut, folks. Reach out. We're all here for you. And until
Absolutely.
next time,
APEC out.
APAC out.